Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Beatriz Olson and Dr. Frances Mei Hardin. Thanks for joining us today, Beatriz and Frances Mei.
Thank you so much, Kim.
You're welcome. And I usually start by saying how we met. So Frances Mei and I have collaborated on a Kevin MD article, How Doctors Can Have Successful Crucial Conversations. And we recorded a podcast with Kevin about the article. And Beatriz sent me a copy of her book, Mind Body Secrets. It's a very good book. I dog-eared a lot of pages. And she lives pretty close to me, so I suspect we'll meet up in person one day soon. And I thought it would be interesting to introduce the two of you and how you'd complement each other as a later career endocrinologist and an early career ENT, both passionate about physician wellness and championing positive changes in healthcare. So by way of more formal introduction, Beatriz is a mind-body integrative endocrinologist, metabolism and menopause expert, author, keynote speaker, and transformational leader and guide for women, physicians, and health systems, and an artist. And her picture in the background, she painted herself, and I think that's incredible. And yeah, that's beautiful. And Beatriz says that as a doctor, author, leader, and coach with 3 decades experience, her mission is to transform healthcare by integrating evidence-based data with holistic and spiritual approaches. She's committed to enhancing both patient outcomes and physician well-being, striving to create a more humane, holistic, and effective healthcare system. And that is fantastic. I love that. And Frances Mei is a head and neck surgeon who brings high quality care to a rural community hospital patient population. She's passionate about physician wellness and ensuring that the next generation of medical students and resident physicians receive education and training that is psychologically safe and effective for the modern learning landscape. She's been a featured speaker on topics such as application of dialectical behavior therapy and form skills that can be used by medical students and resident physicians to increase their distress tolerance and interpersonal affective skills. And I love the work that you're doing, Frances Mei, so thank you both. And today we'll be talking about your experiences as residents that sparked your mission to champion physician well-being. And something totally different, Beatriz is an artist and Frances Mei's passion for writing and publishing. So as we get started, I'll ask you each what you'd most like our audience to know about you. Beatriz, would you like to go first?
Well, thank you. Thank you for being here and for asking me to be here. I am passionate at this stage of my life for helping women become more empowered at multiple levels. Women physicians have gone through a journey through a medical system that in some ways is highly male-oriented and a militarized system where we become conditioned to behave in a way that makes us acceptable. And often we have to hide our own femininity, our own wholeness as humans and as women to be able to fit in the system. And if we divert from that experience, we are somehow there's biases that develop around us, and we're taught to not be vulnerable and not to say our truth. And at the end, to take care of others above ourselves. So ultimately, as the medical system has changed, we have lost the capacity to understand what our inner needs are, because we always gave them to others and we disconnected from ourselves. So my work is to bring a more holistic approach to reclaiming our wholeness and to reclaiming our humanity as women, as physicians, and as people that really value conversations with our patients, that value having a quality of life that matters, and that work together in a system that currently is about making us cogs of profitability and changing that to being a system that is driven by the humans that drive it, both the doctors with our knowledge and our wisdom, and by the patients that help us identify how we can help them better through our knowledge. So that's a big thing that I want to make a commitment about. I'm older now, so I want to help. I'm in a different stage of life. I want to make a difference. I wrote my book to help counteract the obesity epidemic and the sickness epidemic that is happening in the world. So that's more for the general audience. My new ebook on enhancing well-being for physicians really focuses on the physician story and the patient-physician dilemma.
Well, thank you very much. And I love that you can speak out loud to all of these truths, right? Everything you said, it's true and it's happening and we need to do something. And thank you for raising your voice. I appreciate that. So Frances May, what would you like us to know about you?
Absolutely. Thank you. And yes, Beatriz, I really I love your philosophy and I'm excited because I need to check out your books. And so in terms of an introduction to myself, I do find that a lot of my work, even though it might not seem connected directly on the surface, it is all ultimately, I think, like cosmically connected. And so, yes, I practice full time as an ENT surgeon. And for instance, I had some great cases earlier today. I did some PEDS cases, some sinus cases, things like that. However, when I'm not at the hospital, I spend a lot of time working on and developing skills that provide career agility and then also help improve all these areas like in the dialectic behavioral therapy or DBT model. Those four arenas are mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness skills. And so, what I do think is so rich about that world is that what doctor, what healthcare worker, but what doctor wouldn't benefit hugely from optimized emotional regulation and also interpersonal effectiveness, you know? And then, of course, for the subset who find that they're encountering a lot of challenges in the workplace or things like that, that's where that distress tolerance piece really comes in. And I love the framework. I really am passionate about basically learning from industry and areas that have really done things well. And I think that, you know, graduate medical education, certainly, but the healthcare industry can learn a lot from business and again from industry.
Hmm.
Mm.
Well, well, thank you, Francis May. And as you can see, there's so much synergy in your missions. That's why I wanted you guys to meet each other, you women to meet each other, not guys. And so, Beatrice, you could speak to anything you'd like to what Francis May just said. And then if you want to lead into what we were going to be talking about is your experience as a resident that sparked your mission to champion physician well-being. You had a story to share with that.
Yes. Well, first, I just want to say, Frances May, it's such an important thing, the point about the mindfulness involved in our work. Um, I, as a mind, body, spirit trained person, I truly believe that in a medical system or in any system where we cannot be aligned to our inner beings, we're functioning from a place of fight and flight. And I think the approach that you bring allows for people to regroup together to their wholeness, to their own resilience, and their own capacity to move forwards. I ultimately feel that the system needs to be changed. We can create more resilience and strength for ourselves to deal in a system that is not healthy for us. But ultimately, there has to be a change at a higher level that creates health for us rather than us continuing to become accustomed to that higher level of abuse as I see it and system that causes illness for everyone. But I do think we need to do that before we do anything else to train ourselves to be strong. So my story in continuing this is about, again, mind body experiences. So I was chief resident and I was about to give grand rounds. And I was chief resident in internal medicine at that time. I had not become a fellow in endocrinology. And I was in the front of the stage. I was about to give a talk, and it was about fever of unknown origin. And simply, we didn't know what was causing the illness, but my job was to present the differential diagnosis and to discuss what it could be. And I was prepared, yet an inner part of me that I was not connected felt very uncomfortable and very anxious and had imposter syndrome. All of these things I was unaware of as I was standing there. And as the lights went down, I began to lose it. And I passed out in front of an auditorium with 100 students and physicians. When I opened my eyes, no one had come up to help me, and people were leaving the room. and and I felt such shame at that point. I was a young doctor at that time, trying to do my best and so insecure inside, ultimately, so feeling that I wasn't going to be enough. And all of those factors came together for that to happen. And no one said, I'm sorry. No one, it was really remarkable. And it's both of an example of the things we need to tend to, how we need to make our younger trainees, our younger residents know that we have your back, that this is not life and death, this is not, so in retrospect, I was trying to do a very good job, but my inner being was telling a different story and was counteracting my efforts of what I was trying to do. My truth was inside, and it was the emotional, the psychological truth that took over at this point and prevented me from talking. And this is why I believe so strongly that we have to work mindfully and caringly and compassionately with the people we work with, and we need to help them and be more collaborative. Collaborative is a really big word, or generative. I talk about generative communication, generative conversations. And it's about how we can stop competing with each other, or stop rejecting the humanity of others, and instead embracing it as our own. We're all one cosmically, consciously, and we need to do that more. And that's one of these examples where I really learned so much about the power of the mind and how it had to be harnessed in a loving, compassionate way to make a difference.
So Beatrice, when I read that story in your book, my heart just broke, and I was thinking it was almost too much to be believed. And that, like, what if you were having a medical emergency? Like, I can't even believe that that happened, that not one person came to support you. Like, I just wanted to cry. I'm just so sorry that you had that experience. And Francis, May, anything you'd like to speak to Beatrice's story, and if there's then whatever you'd like to share.
Yeah, absolutely. No, I mean, it almost brings me to tears because that, what your mind and body went through. I think of the quote, if you don't make time for your wellness, you'll be forced to make time for your illness. That like famous adage, but then really the response from everyone else, that breaks my heart kind of like doubly. And what I mean by that is that I do recognize a lot of that culture in my own medical education and training experience. But, in terms of value alignment and things like that, I do not think that that's okay. And further, I don't want to work at an institution or really in a career where that type of behavior is normalized. So it's very tough. And of course, there's a million different versions of bystander effect and awful things that we witness even during our training, even when the abuse or neglect isn't directed at us, but we are witnesses to it and things like that. And what I always try to remind people is just at the end of the day, or maybe at the end of your residency training or at the end of fellowship, you still need to be able to sleep at night. Like, you need to be able to live with yourself. And so I think that we can't do enough prep on the front end of even undergrads, pre-meds, medical students, things like that for, hey, you're going to go into an incredibly challenging environment. Nothing could really prepare you for it, but I do want you to have the best skills and tool set possible, because you're going to be challenged, not just mentally, physically, spiritually, but really like your character will be tested. And people's characters do come out in these types of situations, that we run into at the hospital.
Mm. So I didn't know if there was a story you wanted to share with Beatrice from your training, either personally or one that you witnessed, or something that another resident told you about.
Yeah. So, one example that comes to mind, and I will say, I did a 5-year ENT residency program. And yeah, by the time I graduated, there was so much trauma entangled with that experience. And there was so much that I had given up during my training, or that, was taken from me that I didn't necessarily willingly give, that I just try to help other people be more thoughtful about this. But the specific example I would like to share is where I was a mid-year resident, just to keep things de-identified. I was in the middle of training. I had a senior resident. I had a junior resident in this case. The junior resident was much newer to taking junior call. The senior resident could be a challenging personality at times. And that junior resident showed up to an airway emergency, which we all do as ENTs. That is part of our like pretty foundational work. And everyone gets thrown in the deep end, and you sink or swim, and you have to learn how to do airway emergencies and things like that. We did take home call. And so this junior resident was called over the weekend to an emergency. He showed up in the ICU. He actually happened to already be at the hospital seeing consults. So that's actually very convenient. Like, and he was close. And honestly, I will say that this junior resident was a very well-liked, competent resident, very diligent. It's not like he was eating bonbons somewhere, whatever, they couldn't find him. So he responds to this airway emergency in the ICU. Immediately, like en route, had called his senior. So again, he's doing everything right, but the senior resident's at home because we take home call. So the senior resident's heading in, but ultimately, this was a younger woman. She was in her 20s. She had paradoxical vocal fold motion, which I share that piece of information because ultimately she probably shouldn't have been intubated in the first place for respiratory distress, kind of ups the ante, makes it a little even worse clinically. But she had self-extubated in the ICU. Okay, he showed up. Everyone tried to get the airway. They couldn't. He tried a surgical airway. Couldn't get it. Patient was already coding by the time that the senior resident arrived, and then she passed away. So this is that's a tough outcome. That's not a small thing. Like, obviously what he went through, some residents do go through that level of patient loss and trauma. That's not a small thing. But here's where my part of the story comes in. We all had heard about it. We knew he was going through a tough time. This like very normally cheerful resident, pleasant guy, very pleasant to work with. He looked terrible for like a couple weeks. He just looked, of course. And, next time I saw him, I said, "Hey man, I'm sorry that happened. Let me know if you need anything." Um, but there's no formal way to support or anything. And everyone just kind of keeps doing their job. Okay. Well, a couple weeks later, we're sitting in the resident office. We're all sitting in there and we're waiting for lecture to start. So everyone's in the room, and a quick consult comes in like a couple minutes beforehand. The chief assigns me to go knock it out really quick in the ICU. It was like airway emergency ICU. We're not far from there. He was like, okay, take an intern with you. So I took an intern with me. We went and saw it. It actually was a very similar presentation. It was like an around 20s female. She was having paradoxical vocal fold motion, which is where, you should be breathing with your vocal cords open, but they start clamping down on you. And, the recommendation for that is just supportive. We say, give them oxygen, like help her calm down, give her oxygen. Don't intubate this person, because if she does pass out from it, then the vocal cords will open back up. So it will actually have been resolved and she'll wake up, regain consciousness. It's okay. So I scoped her really quickly. I gave my recs and I went back to the office. And, in front of everyone, chief's like, "Hey, is that taken care of? You good?" I said, yeah, it's good. I said, it was a young lady. It was PVFM. I told them not to intubate her. I'm going to pop my note in. So, we sit down. He turns to the junior resident from the recent death and he goes, "Hey, we have another girl for you to kill." And then there was tons of laughter. I mean, I didn't laugh. I don't find that funny. Tons of laughter in the room. So I can only imagine how that guy felt because he hears that. I looked over at him. He looked like he was going to cry at his computer. Nobody said a word. He didn't say anything. Um, but that's just an example. That's like one day. And honestly, in my residency experience, most days were kind of like that. And so you were either terrified for yourself or you were getting your heart broken because I don't want to work at a place where stuff like that happens. Right. And I was too afraid that day to tell the chief, you can't say stuff like that. Come on. I mean, what, that's beyond out of pocket, beyond unprofessional.
Right.
I wasn't his level, but I was old enough to have probably known better and been like, shut up. But no one said anything. Everyone was pretty afraid of him. So a few months later, I was alone with that resident again. I said, hey, I do want to formally apologize. Like, I don't think that's okay. I wish I'd said something then. I'm apologizing now. There actually happened to be another junior resident in the room, and she even jumped in because she just wanted to say, you know what? I apologize too. She said, I might have been one of those people laughing. I have a nervous laugh. I don't think it's funny, but I mean, like in an extremely uncomfortable, traumatic situation, she was like, "That's one of my reflexes." And I know many residents like that. I don't have that one, so I was like one of the only people not laughing.
Well, gallows humor is one thing, but that just added to that poor resident's trauma, and that should never ever be okay. And I know, like you're saying, that's just one tiny example of what you endured, and it shouldn't be like that, and it has to change. So, Beatrice, whatever you'd like to speak to that and add.
Well, I'm really emotionally touched by this story because I've seen this so much. And I think that the shame, the shaming, and the blaming, instead of supporting our suffering, is central to what needs to happen to change. And I think more in the surgical fields, Francis May, I think probably you would say that surgical fields are more tough in that sense than in the medical fields, I would say, of shaming individuals. And if it wasn't hard enough for us to judge ourselves enough to be so perfectionistic in our process to get there in the first place, we check ourselves all the time that if we cannot be supported under those major circumstances, it's unthinkable, unthinkable. And we need to fight against that. We need to fight against that. And I'm so happy that you're voicing this, even though you're not saying where it was or what happened. Because yes, if we're stronger, if we're wiser, if we're more empowered, if we had more agency at your age or my age when we were going through this, we could have said something different. And we would have said, I really feel that this is the wrong thing to say. We must support our colleague. And we need to be told what to do because it's always the pack and the fear of going against the top because we're going to get hurt. So that's unacceptable. Unacceptable. I'm sorry. I'm sorry that that happened to your group and your team. It breaks my heart.
Well, and
It's
sharing these
actually,
stories is so
I,
important. I always say when a doctor shares their story, another doctor feels less alone. And it's so important to shed light on these. And also, though, what we're doing with these episodes too, in which we could move forward, and Beatrice, I don't want to interrupt you, so you could go ahead, is that also they shaped and formed you, the experiences you've been to, but look what you're both doing now to support physician well-being and to help move the system forward in a more positive manner, and that gives other physicians hope. So go ahead, Beatrice.
I was just gonna, yes, and that is true, Kim. But I was just gonna say that Frances May's story and the actually is a post-traumatic hit for that individual, and that predisposes that loss of agency, that shame in the group isolates that individual and puts that individual at risk of suicide. And I was actually thinking, Francis May, as you were telling the story, oh no, he's going to be gone. And those are the circumstances that are very dangerous. And we need to educate everybody about that. So,
Totally agree. Thank you. Yes, I mean, thank God, fortunately, there was not loss of life. But, I do think that in terms of where the bar should be, it should not just be that we survive residency, it's that we survive intact, which again, I cannot say. I'm not sure that he could say that.
Or thrive, right? Not just
right,
survive. You should
right.
be able to thrive. You should be supported. And I talked to my college friends a week ago. We were physical therapists, and we again talked about in our training, it wasn't like that. We supported each other. Our, professor supported us. None of us had experiences similar to that. And it doesn't have to be that way, and it shouldn't be that way. Beatrice, if you'd like to speak to what you're doing to support physician wellness, and if you even want to go on and tell us a little about, what you do on the side and your art.
Yes. So I'm very interested in, as I mentioned, I'll be talking in the Women in Medicine conference coming up in September about a different agency for us women. So I'm really excited to be a mentor for younger women to redefine themselves and to figure out what is it that they really want. And it is possible to someone like me who can practice academic medicine, can practice mind body medicine, and still have a practice where my patients pay me and are happy to pay me for my value. That's like a bizarre thing to say in a system where we work at. So that's one of the things I have. This little book right here, which is my ebook, which is Enhanced Wellbeing for Physicians, which I wrote, which I want to gift. Everybody that wants to have it, I want to gift it because it's a lesson to evolve. And on the side, I'm an artist. My children are grown. And I have dealt with a lot of my suffering with my art. I do acrylics, I do mixed media when it's complicated. And I think art has the capacity of giving language to things that we cannot say out loud and that we cannot perhaps gather because of our conscious or protective systems that we have when we're younger. So art creates the capacity to touch those things and to evolve from them and move us to a higher level of consciousness. So that's what I do on the side.
I fully believe that. I love that. I think art is so important as well. So Francis May, if you would like to share a bit about what you're doing to support other physicians and also about your Hippocratic Press.
Yeah, thank you so much. And Beatrice, I do love the painting behind you. That's the first thing I thought when we all hopped on the call. So incredible that Kim says that that's your work. Like, that's beautiful.
Thank you.
So, when I came out of residency, ultimately, I mean, it took 6 months before I created anything. But like speaking to your experience as well, art, creation of resources, content, um, and sharing my story has been very healing. And I'm really just trying to put resources out into the world that didn't exist when I was a resident. And when I did used to lay on the ground of the bathroom floor in the hospital basement, like every evening, 9 p.m. on a weeknight, I would Google like resident physician suicide and resident physician depression and leaving residency and things like that. Nothing ever really came up that was helpful on Google at the time. I mean, thankfully the landscape's even different over the several years since then. But I feel passionately about that. And so, I've been working on my own book for a couple years. It took several months to get an agent, and I'm in a writing group that has really helped me build a totally new skill set because I'm great at documentation of op notes and clinic notes and things like that, but it's so different to really like notice things as an artist. And I really appreciate the opportunity to mention, as Kim said, our new publishing house. So I created a publishing house. It's called the Hippocratic Press, and it is for people in healthcare, for physicians who feel like they've had this book percolating within them probably for years. And especially most of us, you know, particularly academics, things like that, you know, sometimes they don't feel comfortable with the self-publishing process. And of course, traditional publishing landscape, you know, it's changing every year. It's very dynamic, it's very challenging, it's time intensive. And I know that having gone through, you know, many steps myself. And so our publishing house just aims to make the process much more seamless, time effective for physicians and again for healthcare workers who want to share their wisdom and get it out into the world, you know, on our imprint.
Thanks.
I'm
And
so happy for you.
yeah, and if you want to add all the things that the publishing that the Hippocratic Press does, right? Because when you show me the website, there's a whole list. They'll help with anything. You know.
Exactly. And yeah, so basically, this is for people at this current stage, which is a newer publishing house. If somebody has a close to finished or finished manuscript, that's where we would come in. We have on our team a developmental editor. We have a proofreader. We have line editing offered as well. And so all that can be done to make sure that the final manuscript is the best that it can be. Then we have everything from the design aspect, cover art, illustrations, graphics for the book, typesetting. We have artists on the team who are professionals at that. Like, you know, yes, it's founded by a physician, me, but a physician will not be typesetting your book. And that's what you want, because we all want the same thing, which is a really gorgeous product. And so we do all that. And then, of course, launch and marketing. That's a huge hurdle to many people. And that's, of course, such a really critical time to work on things like velocity of sales, to get on a bestseller list, and to come up with social media campaigns and full marketing campaigns. Do we want to run ads? What reviews do we want to seek out? And things like that. So it's basically everything. If you've done the work and you have your manuscript to a spot where you would like to work with us.
Well, thanks. I think you're both amazing. And as we're winding down, Beatriz, is there any last parting words you'd like to share with our audience, as well as how our listeners can get in touch with you?
Well, I'd like to thank you, Kim, very much for how you've taken your journey and elevated it to a new level, to allow the conversations that are happening between us physicians to shift the balance and to create healing in the world where it really needs to be. So both for patients and also for doctors. So that's number one. I can be reached at BeatrizOlson.com, BeatrizzOlson.com. And I have a private practice. I work 3 days a week doing integrative endocrinology and coaching women with their hormones. And I work with weight regulation and, of course, with healing women physicians suffering. So those are my direct works that I do. And of course, I do other work in other places, but this is what I want to share.
Well, thank you, Beatriz. And Frances May, any parting words for our audience, and also how our listeners can get in touch with you?
Absolutely. And I want to echo Beatriz's sentiments. You know, it's wonderful to meet you, Beatriz, and Kim. The work that you have been doing for you know, quite some time now is really impactful, and it's awesome to watch you grow in your business here. So in terms of, you know, a relevant quote, I really love this one from Marcus Aurelius from his Meditations. And the quote is, "The best way to avenge yourself is to not be like that." And I love that. I think that does apply to some of the themes that we talked about today in medicine. And I can be reached at my Instagram, which is at francismay.md, and at Rethinking Residency as well. And then people are always welcome to check out my website, rethinkingresidency.com. And of course, the Hippocratic Press website, which is hippocraticpress.com.
Okay, well, thank you. I'll put all those links in the show notes. And thank you again for being my guest. I loved having you, and I'm glad this worked out. Our listeners wouldn't know that my power went out and this almost didn't happen, but in the end, we made it work. And thank you both very much. And in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you.